Clapping for doctors and nurses, for many a matter of the heart. Thousands of people gathered at their balconies and windows to applaud the frontline workers when the virus swept across Europe in spring 2020. But all that applause doesn't help to make ends meet. In many places around the world, healthcare workers are taking to the streets. They demand better working conditions and better pay for their often dangerous work. More than 120,000 nurses and care workers have already died of COVID-19 worldwide. Welcome to COVID-19 Special. I'm Monica Jones. Good to have you with us. Well, from superstar to afterthought. That's how millions of healthcare workers must feel these days. No more clapping and certainly no celebrity paycheck. At least a special tribute to frontline workers in South Africa. Our correspondent reports from Cape Town.
Over the last 17 months, we survived, just barely, as an orchestra. We couldn't have live concerts. Today's the first live concert that we can have in the outdoor. We think it's very important to say to the medical workers of South Africa, we see you, we hear you, we honour you, we thank you. They have to go through the trauma of seeing everyday people dying and help South Africans. So this is basically to say thank you.
We are very grateful if we can get some entertainment here, because with COVID, everybody's morale is low. So this is some upliftment for staff and patients as well.
The pandemic in general has been really tough, I think, in every aspect, emotionally, physically, mentally as well. But like I said as well, we've been receiving a lot of support, whether it's a free coffee or a free concert from an orchestra. It really does help boost the morale as well. As we bond together, it really helps knowing that we're not alone.
I haven't seen so many staff outside in the last 18 months, so it is absolutely amazing.
I would like them to sing every day. It will be a good thing.
South Africa is slowly emerging from a third wave of infections. The staff here has been working in crisis mode for months. And while many here are happy about this concert and this appreciation, some are also demanding more structural changes to improve their working conditions.
We do really work hard, and more appreciation would be like a very wise thing to do, because we are the ones who are more exposed to all things that are happening out there. So salary-wise, I can say, yeah, more appreciation in that way. And in so many ways, just to show that they appreciate what we're doing.
Healthcare workers do definitely need more acknowledgement. So our cry is more money for our staff, because they work extremely hard. And we all need, all across the world, it's the same phenomena. We need more staff to look after our patients. Around about 150 COVID-positive patients in the hospital today. We have seen that number decreasing over the last few days, which is a good sign for us. But like I said, we have to still stick to the precautionary measures.
Well, free concerts are nice, but it'll take more to compensate health workers for the incredible job they're doing, especially now during a pandemic. Well, let's bring in Howard Catton, the CEO of the International Council of Nurses in Geneva. Good to have you with us, Howard. And I know you've just visited Rwanda, where you had the chance to meet nurse leaders from several African countries. What did they tell you about their work on the ground and how they cope with it all?
Very good to be with you. Look, nurses across the continent of Africa, they're tired, they're exhausted, like nurses in many parts of the world. But what I was struck by was that they are feeling more vulnerable, more at risk because of the slow rollout of vaccination programs across the continent. In high-income countries, we've got vaccination rates of populations at 60, 70, 80%. 2% or less in many African countries. And then you delve into what that means for healthcare workers. And we've done some work which has identified that there could be like a third of healthcare workers who are still waiting to be vaccinated. So whilst they've heard the promises of, yes, we'll prioritize you, there'll be vaccines that will be shared, they're not seeing the reality of that. And that makes them fearful that they're going to get sick, that there are risks to their family. And we know tragically that some nurses have already died as a result of contracting coronavirus and are more at risk. You know, in the last few days, we've seen a billionaire take a healthcare worker into space. But here on planet Earth, we are still not vaccinating all of our healthcare workers. And that, to me, should be our absolute priority.
And of course, in order to make matters worse, in rich countries, including Germany, all over Europe, there are quite a lot of healthcare workers who refuse to get vaccinated, even though there is enough of the vaccines around. Other than that, how does the situation in Africa's health sector compare to that in Europe when it comes to the situation of nurses, of doctors, of staff?
Health systems in Africa, on the whole, don't have the same level of funding and investment as in some of the high-income countries, of course, and that presents challenges, particularly for healthcare workers, for nurses. It's about not having enough staff. We went into this global pandemic with a shortage of 6 million nurses across the world, but that shortage wasn't spread evenly. It's concentrated in lower income countries. We think about almost 90% of global nursing shortages are in lower income countries, including Africa. But what we're seeing now, which is really a worry, is that high income countries who've got shortages are looking to countries in Africa to recruit, to address their shortages. And they're saying it's okay to recruit because there are nurses who are unemployed in countries like Kenya, for example. That's true, there are unemployed nurses, but when you dig a little deeper, it's because there isn't the funding to employ those nurses, but there is clearly the health needs of the population who need more nurses. This is complex, but again, it's an issue we need to be addressing globally in order to get out of this pandemic.
So healthcare workers all around the world were applauded, but they're still stuck with bad pay. That's not really an incentive for young people to get into this line of profession.
Look, nurses are not superhuman. Yes, they are doing extraordinary work, but they're ordinary people like you, like me. They are looking to be protected and safe at work, to be valued, to be respected, to have fair reward, to have career opportunities. It's not how loud the world claps or how big the promises that politicians make are. It's delivery on the ground, both to recruit the next generation and to retain the valuable staff that we currently have.
Howard Catton, the CEO of the International Council of Nurses. Thank you so much.
Thank you.
Time for one of your questions now. And as always, our science correspondent Derek Williams is here to offer an answer.
Can the virus be transmitted via an insect, like when a mosquito bites you?
The answer to this question, we're quite certain, is no. But what makes the question really interesting is why the answer is no and how scientists came to that conclusion. Because the answer to the question might just as easily have been yes, right? I mean, after all, there's a long list of nasty diseases that are mosquito-borne. First and foremost among them, malaria, which is caused by single-celled parasites from the Plasmodium group. But mosquitoes can also transmit a number of dangerous viruses, among them those that cause yellow fever or Zika or West Nile fever. But other horrible pathogens, like the ones that cause HIV or Ebola, for example, and SARS-CoV-2, they're transmitted mostly from human to human. They aren't carried by biting insects like mosquitoes. So why? Well, it comes down to whether or not the insect can itself be infected. When it bites someone who's infected with a disease-causing pathogen, the blood that a mosquito swallows, of course, enters its digestive tract, which naturally has multiple defenses to prevent the mosquito from being infected by its dinner. To be passed on by the insect, the pathogen has to overcome those defenses. Then it has to replicate inside of the mosquito, and then it has to reach its salivary glands in sufficient numbers to infect a new host. And not every virus can manage that. It requires evolving a highly specific set of abilities. A flurry of studies early in the pandemic showed that, like other closely related coronaviruses, SARS-CoV-2 apparently can't replicate in insects, which led healthcare authorities to heave a huge sigh of relief. Because they transmit so many deadly diseases, mosquitoes kill more humans every year than any other animal out there. But at least they aren't making the COVID-19 pandemic any worse.
And finally, the pandemic has taken a heavy toll on tango culture because the dance requires close physical intimacy. But there are signs the dramatic Argentinian dance is making a comeback. The Buenos Aires Tango World Cup is in full swing following COVID-19 health protocols and with reduced capacity. Dancers from 25 countries will go cheek to cheek in 2 categories, salon style and stage style. Competitors will be able to participate in person and virtually. And that's all. Thanks for watching.